So we have one more person, certainly not least, but last on the agenda today, and it's my good friend and colleague, Geoff Miller from the Department of Defense and Eastern Virginia Medical School, and he's really one of the pioneers in simulation-based education, and he's going to talk to you about a project that he's been working on for a number of years.
Thank you very much. So I'm going to discuss a problem, and it may sound familiar to some, probably a lot of people, but my goal is really to democratize expertise and democratize the ability for every learner to have access to expertise. So our problem that we encountered when we ran into different learning situations in our simulation lab at the medical school is that frequently we had opportunistic availability of clinical faculty for simulation-based teaching, right? So we didn't necessarily have the best person there, the ideal person. It was whoever was kind of stuck doing it, working with our technicians and simulation educators. And not everybody got the same experience. To compound that problem, we would have 20 residents in a room doing airway training with one clinical faculty. What is their opportunity for access to expertise? Not very good. So we started thinking about the problem and how can we leverage some of these emerging technologies to create the opportunity for everybody to have access to expertise. So our first version of this, going back about 3 or 4 years ago now, and for those of you that were here in the spring of 15, probably heard the first version of this. That seems quite old now, but we worked with a very young, enterprising group of computer science engineers and other industry partners that we work with in the Hampton Roads area. And we hacked the Microsoft Kinect, right? Before they released the SDK, we kind of got in there and started playing with it with the idea of, can we capture the performance of experts in 3D time-space models? So we bring expert clinicians in who are very expert. We picked endotracheal intubation via direct laryngoscopy as our research case because it has a highly refined procedure. It's very stepwise, very concrete. We said, can we capture this? So we captured hundreds of different experts intubating. And we captured these in 3D time-space models. And then we crunched all the data together to create this sort of expert model. And then we created a game-based platform that students could come in and play against the expert and receive immediate synchronous feedback about their performance with both audio cues, visual indicators, to try and encourage them to mimic both the body motions, actions, sequencing, and activities of the expert. And the student can come in and do this anytime they want, 3 in the morning, 3 in the afternoon. The expert was built into a semi-autonomous system. So we're continuing to do that work, and we think this is very important work, but we think there are more questions that have to be answered, many, many more questions. And we think we have to get this to a way that actually makes the system more accessible to more people. So I've been kind of waving this thing around in my hand. I mean, we're moving into augmented reality now, where we're migrating the original system of stands and Kinects and computers and cameras all into one single platform, with the idea being that this can be sent to many more places than the rest of that system can. So we're continuing to explore this. We're very excited about it. We think this is the way to create an opportunity for every student, regardless of who you are, to have the access to the expert and become one yourself. We also think this is important because of some other work I'm doing with DoD in one of our sister labs, and that is we're making a move into the future of semi-autonomous medical devices. We have to map the expertise of the human for these devices to start to understand. So we're blending computer vision, machine learning, artificial intelligence, thinking about the future of not just education, but future devices to provide patient care. So please feel free to come chat more. I can talk for days about this. It's very exciting and very happy to be back here. Thank you.
Thank you, Geoff.